afternoon. I'm Brandon Scott, live at the Children's Miracle Network Radiothon with Gunderson Health System and Midwest Family. We are at Gunderson in La Crosse. The Radiothon going on until 6 o'clock here today, also 6 a.m. to 6 p.m. tomorrow. I want to thank our Miracle team, IC System, on the phone bank this hour. They're going to be answering calls and taking donations via phone, so feel free to give them a call. There are several ways that you can donate to make miracles happen. That's, of course, why we're here today. So feel free to donate whatever you're comfortable with because you're the one that is changing kids' health and changing the future. So if you want to make a one-time donation or if you want to make a reoccurring monthly donation, whatever you're comfortable doing. Again, there are 3 ways. You can call 608-784-KIDS. That's 608-784-5437. Or you can text CMN Kids to 51555. Again, that is CMN Kids to 51555. Or a secure online donation can be made at Around River City, and that's where you can watch a live stream as well. So there you go, a few ways that you can donate here this afternoon. If you're wondering where the money goes, 100% of donations, every dollar goes to the Gunderson Health Help Fund. It supports various programs, items, life-saving equipment, medical care, preventive education to help local families here in the Cooley region that may not be covered by insurance. So there are 0 administrative costs taken out of your donation. Every dollar stays local and goes to support these families. And we do have a family here with us right now. I'm here in the Team Marine family room, and I want to welcome the small family from Rockland, Wisconsin. We have 7-year-old Emerson, also mom Kristen, and dad Tyler. Thank you guys for joining us today.
Thanks for having us.
Yeah, absolutely. So let's talk about Emerson. She's been fighting a rare genetic condition since she was essentially born. So walk me through her condition. From what I understand, it's so rare, there's really not any research on it yet. Is that correct?
Yeah. So when Emerson was born back in March 10th of 2014, during our pregnancy, we had all normal ultrasounds, no indication that anything was wrong with Emerson. It wasn't until she was born they saw that she had a cleft palate. So like in her mouth, the roof of her mouth had like a split in it. And then she had a foot deformity. So both of those were not seen on ultrasound. It wasn't until we went over to postpartum, we met with Dr. Yadley, who is the genetics pediatrician here at Gunderson, and she kind of looked at Emerson's features and decided that she believed she had a genetic condition. So we did a lot of genetic testing. The first testing we did came back negative. We did a bunch more testing, and it was concluded that she has a duplication and a deletion of 2 of her chromosomes.
Okay.
So it's so rare that like they've never seen a combination of them. They've seen one by itself and know what that can lead to, and then the other one, but they've never seen them together. So we joke sometimes like this might be Emerson syndrome, and someday they might call it that because of her. And
just how rare it is. I've heard of the duplication of the chromosome. I never heard of the deletion of a chromosome before.
So like basically she's missing part of her chromosome, which accounts for different characteristics and features and disorders that kids have with having that deletion of their chromosome. So we spent the first 25 days of her life in the NICU here at Gunderson, just going through like every different test and procedure. She had her first actual surgery when she was 2 weeks old to place a G tube because she was having such reflux and not being able to eat and would turn blue when they would try to feed her. So they placed a G tube at that time.
2 weeks old?
2 weeks, yeah.
So take me back, what was going through your guys' mind when the doctors diagnosed her? I mean, being so young, what went through your minds as parents of a newborn girl? I mean, your hearts have had to be in your stomach.
Yeah. It was very difficult. Like looking at her, you would not know that anything was wrong with her. And I just remember looking down at her when they placed her in my arms after she was born and thinking like, how could anything be wrong with this perfect little baby girl? And so the first 25 days of her life we were under such uncertainty, like kind of looking to the doctors for some answers, and it was hard and difficult, and it was hard.
So as you mentioned, she's gone a lot of tests at such a young age. How have you guys got through it as a family? Talk about your guys' support system that you guys have as well to kind of help you through this process.
Yeah, so we have an amazing support system. Emerson actually has an older sister who's 14. So when Emerson was born, she was young, and just kind of having to balance being here at the hospital with Emerson and being home with her sister Kaylee, that was very difficult. So trying to balance our time, and our family is amazing, and our friends, we have a huge support system. She has quite a village looking after her. So just having those people to like reach out to and help us, you know, like with anything, like, you know, transportation help and cooking meals and helping with our daughter Kaylee, it's been amazing.
Okay, and so walk me through how you got connected then with the Children's Miracle Network. How did that process come about then?
Yeah, so they kind of got involved right away when she was first born. So when we were in the NICU for almost a month, they supplied us with meal vouchers to go to the cafeteria, which was a blessing just to be able to stay close to Emerson and not have to leave and not have to think about something so simple as eating, but you don't when your child is hospitalized, and you know, the last thing you think about is yourself. So trying to get away to like eat, and that was awesome to just have that taken care of for you. And then we live in Bangor at the time, so it's about a 25-30 minute drive. So every day Tyler and I were coming back and forth, and having gas cards by the Children's Miracle Network supplied to us, it was amazing to be able to not think about that expense when you're here and trying to take care of your child.
Yeah, the miles certainly add up. When you're from Bangor, you're traveling back and forth. That certainly adds up after a while. So having those gas cards, you know, and also the food vouchers as well, so you're not eating out constantly. You guys can get, like, you know, a home cooked meal as well. So again, we are here. It's the Children's Miracle Network Radiothon with Gunderson Health System. We're talking to the small family. We encourage you to donate. There are 3 ways you can do that. You can call 608-784-KIDS, or you can text CMN Kids to 51555, or you can make a secure online donation as well around rivercity.com. You can also watch our live stream right there as well. So there are many, you know, items and services funded by CMN hospitals. That's why donations are so important and valuable, because obviously they go a long way into helping for families. So outside of the gas cards and the meals, what are some other things that CMN has provided you guys in this process?
So over the last 7 years of Emerson's life, there's been like equipment that hasn't been paid for by insurance, and whenever you put the word adaptive in front of every piece of equipment, it gets more and more expensive. So trying to fund those things, CMN has stepped in, no questions asked, with things like her Rifton chair. So it's a little chair that she sits in at home to help her sit up well and feel supported and not, you know, fall over. They've helped with a Bennick belt, which is a belt to cover her G-tube when she was little, when she was like rolling on the floor and not get it stuck on anything. They covered the cost of a medication that was expensive that the insurance denied unexpectedly, and they stepped in and no questions asked, they covered it right away.
That's so valuable, because, you know, medical bills can skyrocket, especially some of these machines run $20,000, $30,000, $40,000. So getting those machines, and then of course you mentioned the gas cards and the vouchers. So how is Emerson doing today? What's like a typical day like for her?
So Emerson is 7 years old, like we talked about. She is in 2nd grade at West Salem Elementary. She loves it there. She just thrives at school. She has a bunch of little friends that, you know, tell us like, Emerson's my girlfriend, or she's my best friend. And it's so cute because she doesn't talk. She's nonverbal. So it's not like Emerson could be like wanting to be their best friend, but they love her and they adore her. And we love that, you know, West Salem has been amazing with like being inclusive with her, and it's been great. We still have quite a few appointments.
Okay. As the phones are ringing, we're getting donations coming in. That's a good thing.
Yay.
Keep calling.
So she has quite a few appointments. We're here for physical therapy once a week. I would say multiple appointments a month, just driving back and forth for those. And overall, she's pretty healthy and thriving, and just kind of take it day by day with not knowing what her diagnosis will bring each day.
Sure. Is there any word from the doctors about as far as like research coming along with this at all that you're hearing?
So I think continually, there's always more and more research out there for genetics, and I feel like each year brings more, things that we didn't know last year possible for genetics. So I think eventually we'll maybe have some more information, but she kind of writes her own book, and we just kind of follow it.
Absolutely. Well, your story is very inspiring, for others that are going through something similar. So thank you for joining us today. Is there a message you want to send to people listening? Why should people, donate to the Children's Miracle Network?
Yeah, I would just say, even if you can donate just a small amount, $5 goes to like a meal voucher for a family that has a child in the hospital. Emerson's been hospitalized many times over the last 7 years. So just having that is just amazing, and it's a blessing. So even if you can donate $5, whatever it is, this organization is amazing for kids like Emerson in this community.
And it stays local here. All the money raised, 100% of the money, all the donations help kids and families here in the La Crosse area. So again, Kristen, Tyler, Emerson, thank you for sharing your story with us, and thank you for speaking with us today. We appreciate it.
Thanks for having us.
Yeah, absolutely. So again, the phones are open. Call 608-784-KIDS to donate whatever you are comfortable donating. We're here to make miracles happen. You are the one changing kids' health and changing the future. That number again, 608-784-KIDS. You can also text CMN Kids to the number 51555. That's CMN Kids to 51555. Or you can make a secure online donation at aroundrivercity.com, and you can also watch our live stream as well. So we'll be speaking to more families and even some doctors as we head throughout the day. I'm Brandon Scott, live at the Children's Miracle Network Radiothon with Gunderson Health System and Midwest Family.